You're listening to the Monday Night Community Show with Daniel on BRFM.
We're next going to be joined with Mandy live in the studio, and she's a health visitor from the Swale team. Firstly, thank you very much for coming along this evening.
Thank you, and thank you for letting us come along and promote our wares.
Now, I was wondering if you could perhaps give us a little bit of an introduction, firstly.
Yeah, well, my name's Mandy Hughes, and I'm a health visitor for the Swale team, and I'm based on Sheppey. We've actually got the team based in Kent Science Park in Sittingbourne, but there are three teams that have all joined into one, which is Faversham, Sittingbourne, and Sheppey. And I'm with the Sheppey team, and we come out here every day to the island to come and visit families and look after their health and well-being, we hope.
So could you tell us a little bit about your role as well?
Yeah, my role... people may or may not know what health visitors do, but health visitors are all nurses or midwives. And we've all been qualified for varying lengths of time. I've been qualified for quite a long time, quite a few years. We do a specialist qualification in public health, which is an extra qualification on top of your nursing qualifications. And with that, it gives you the opportunity to go out and visit families with children 0 to 5 and to help them to keep healthy and to keep well. Every child in this country that's born has a health visitor allocated to them, and they have a series of different visits that go throughout their early years until they go to school.
And I know you want to talk about the health visiting service for Kent.
Yes, I mean, we're part of Kent Community Healthcare Trust, which is the organisation that employs us. So we're part of the NHS. We are NHS workers, and our team has got lots of different people in it. It's not just got health visitors. It's got community nurses, and it's got community nursery nurses as well, all with their different specialities and experience, but all with the qualifications in community nursing. And what happens is that as a team, we offer a service for the whole of for the whole of Swale, but for the whole of Kent, for every child, as I say, that is born in this area. And what we do is we have a system of home visiting, clinics where we invite mums to bring in their babies and dads as well to bring in their babies to be weighed and to be checked and to have a conversation with if they have any concerns. We also have lots of leaflets and information and advice, and we also have the health visitor duty helpline as well. We actually have a duty desk, so there's a health visitor on duty every day, and so if somebody wants to phone in and ask advice, then we can do that, and we can do that between 9 and 5 every day, Monday to Friday. And we're just started experimenting now, and hopefully this is going to be successful, with a extended helpline, so we can actually speak to parents up until between the hours of 9 and 8 on a Monday, Tuesday and a Thursday. So Monday, Tuesday, Thursday we have an extended helpline, and that's open till 8 o'clock in the evening. And can I give you the number so you've got that?
Yes, you can.
The number is 01795 and it's 433 950. So it's 01795 433 950, and that's for anybody to ring to ask for advice and speak to a health visitor.
Now, I understand that October is Breast Cancer Month.
Yes, it is, and hopefully we're going to be able to do some regular sessions on BRFM, if that's going to be okay. And we're hoping to bring topics that are relevant at the time. So this month it's Breast Cancer Month in October, and we just like to say really that there are things that people can do to prevent breast cancer, and one of the things that we advocate very strongly obviously is breastfeeding, and breastfeeding can help to prevent breast cancer in later life if it's successful and it's done regularly and it's done for a good length of time with your new baby. But obviously there is a lot of advice around that, and there's a lot of we give a lot of advice about breastfeeding, and we also have a lot of networks with breastfeeding counsellors in the area as well, so we can pass people on for more information.
And I know you next wanted to talk about children's development in the early years.
Yes, I mean it's part of the service that we offer is that we like to offer a monitoring for children's development up until the age of 3, and we do have a programme of monitoring, and that is that we go out and visit babies when they're born, when the midwife has finished at around about 14 days, and then we do a visit at 3 months to make sure that everything's okay. We also then do a development assessment at 1 year to make sure that the development of the children are reaching their milestones, that they're actually developing normally. Then we have another development assessment at 2.5 years, which is now going to be reduced down to 2.25 years, as we feel that we want to pick up any problems much sooner. But in between all those development checks, we do offer, the service does offer parents to come to us if they actually feel that there's something wrong with their child or they've got a concern. Even if they think it's nothing particularly important, we're always there to put their minds at rest and refer on to different other agencies like the GP or to speech and language therapy, or to have their eyes tested or their hearing tested, or even to the paediatricians, which are the children's doctors who will to take things further and be able to assess their particular needs. But one thing I would like to say is that we're a health visiting team and we've got different people in the team, but part of that team is our parents, because our parents do know their children better than we do, and we really want to make sure that that what we do alongside parents is a partnership, that we don't go into people's homes to check up on them. We don't go into people's homes without being invited there, and we find that most families are very happy to have us in their homes, but we don't force our service onto them, and we like to think that it is a partnership, that we make a good relationship with the families, that we can be there for them as a team for the early years, and that together we can work out what's best for their children.
Now, I know you wanted to talk a little bit about improving services, I understand.
Yes, I mean, obviously, we do have an ongoing survey that Kent Community Healthcare Trust puts out, so that we actually take an iPad with us, which is quite useful for parents to fill in a survey as we're sitting in the home, and that's been done quite regularly. So if you are presented with that, it's to tell us how the service is going and how you found it, how you found the visits and the development checks, etc. And we also want to hear from parents, just to send us a letter or to telephone us or tell us when we're visiting how they feel that the service could be improved, what they'd like to see as something that would benefit them in the future. And one of those, of course, is the helpline, which we're hoping to do, and who knows what we might be able to offer in the future.
And I know you wanted to talk about community involvement.
Yes, I mean, we've been fortunate in that the government has actually given some funding for there to be more health visitors. We're training a lot of students at the moment to come into health visiting, and that hopefully will give us more time to be able to do some of our public health work. And the public health work is really looking at the whole population out there and looking at how we can improve the health of the population. And for example, there's been a really good project that was set up by Andrea Green, one of our health visitors from our team, working alongside Seashells Children's Centre and the community in Sheerness and around the island to produce a children's community garden, and that is something that we're hoping will help to introduce children to how to grow their own fruit and vegetables and salad, and how to what it looks like, and what you can do with it, and how it affects your health, how good it is for you. And this has been very successful this summer, and some really good produce. And some of you may have seen it actually. Some really good produce has been produced, and that's all the community working together with the services as well, through the Children's Centre and through the health visiting team, for that project to be a real success. So any kind of community involvement, anything that the community sees as a need that actually affects their health and well-being, we like to get involved with, and work alongside people.
So I was wondering, before you go, Mandy, are there any useful contact details where listeners can find out more or contact you?
Yes, I mean, we're hoping to do a regular slot on this show, and we can bring in different topics each time, and different specialists each time who can help with some of the common queries that people have, or even some of the more unusual queries that people may have about health and well-being, public health, or the health and well-being of their children. And I think there's going to be some opportunity for questions to come in, maybe through Facebook, maybe through email, so that we can actually put some programs together on a regular basis.
Yeah.
But our contact details are we're based at Kent Science Park, but the most important contact is the telephone number, and that's 01795 433 950, and that telephone number is the number that goes through to the team, the duty health visitor. And if you do get an answer phone message, don't worry about it, leave your details on that answer phone message and somebody will call you back almost straight away. And if you leave a message after the hours of overnight, unless it's on one of our long extended duty hours, then we will get back to you the next day. And if you leave a message over the weekend, again, we'll get back to you the next day. If you find that you've got your children haven't seen a health visitor for some time, they may have missed a development assessment, you may have moved house, don't worry about it, just get in touch with us, and then we can see on your records whether or not they are due something. And that includes advice and guidance on immunisations, their injections, and anything else that you may have that you're worried about.
Well, Mandy, I'd like to thank you very much for coming in this evening, telling us a little bit about your role and covering some of those topics as well.
Thank you for having us.